I am Dr. Ankur Khandelwal from AIMS Guwahati, Pain Medicine OPD. So this is a elderly lady who has come to us with pain confined into the gluteal area of the left side. She has severe terrible pain. Okay, so which is non-radiating to the lower limb. It's confined to the gluteal area and some parts of the thigh. So it apparently looks as if she has developed sacroiliitis. So I will show you the important tests of how to diagnose sacroiliitis clinically. So first test is the compression test. So in compression test, what we do is that we will put compression on the pelvis. Which course नहीं? कौन जगह? Where? So now she is complaining pain on the left side, which is compression test positive. Second, we will show you the Faber test, FABER, that is flexion, abduction and external rotation. So how do we do it? We flex at the hip joint, flexion, abduction and external rotation, and this leg will go on top of the other hand, and we apply slight pressure here. Normally in a normal patient this leg should go down, correct? It should be able to go down, but in a patient of sacroiliitis, if we try to move it down, the patient will complain of pain. Now I am trying to move it down. Now she is complaining of severe pain as soon as I am trying to move it down. Okay? So this is Faber test positive. Next is Gensler's test. So how do we do Gensler's test? The patient will lie supine and the affected limb, we will ask the patient to put the affected limb by the side of the bed. Correct? And the other limb will be flexed at the hip joint. Now she has a complaint on the left side. So what we do is that we hang the left leg at the edge of the table. Correct? And the unaffected at the flexed at the knee joint. And now we apply pressure and counter pressure. Like this. Which course है? Now she is complaining of pain on the left side. So this is Gensler's test positive. एक बार pause कर दो. Test is the finger pointing test. Okay. So you can see here, these are the two posterior dimples. Correct? These are the two posterior dimples which is corresponds to the area of the posterior superior iliac spine. So when I apply pressure on the posterior superior iliac spine, that is the finger point test, she is in severe pain now. She is complaining of pain. Bisha se? She is complaining of pain. And on the other side also I am trying to press. Bisha se? Correct? So this is finger point test positive. Pause. Now we have come to know that she is suffering. Now we have come to know that she is suffering from a left-sided sacroiliitis, and we will put a steroid injection in the sacroiliac joint by ultrasound method. I will show you the video. Thank you. So as I mentioned earlier, this patient is suffering from left-sided sacroiliitis, and now we are going to plan ultrasound guided sacroiliac joint injection of triamcinolone. Right? So as you can see here, I have placed the ultrasound probe, the linear probe, in the dimple, that is in the posterior iliac spine, in the area of the posterior iliac spine, and I am trying to focus the sacroiliac joint. As you can see on the screen, this is the lateral part of the screen, this is the medial part of the screen. And you can see these two hyperechoic structures. This is the iliac bone, and if you can see, this is the sacral bone. Okay, the lateral end of the sacral bone, and this is the medial end of the iliac bone. So this is the joint space. If you can appreciate clearly, this is the joint space between the sacrum and the ilium, where I will put the needle through this point. Now my target is to give a sacroiliac joint injection. I am putting local infiltration, right? Because otherwise it will be painful and patient will not be in a comfortable position to allow us to do the procedure. Right. You can see these are the two structures. This is the medial and lateral end of the iliac bone, and this is the sacrum. This is the sacroiliac joint where you have to go inside. So keep the screen. So this is my needle. I am going through the sacroiliac bone. See, so inside the sacroiliac joint, as you can see on the screen, sacroiliac joint, right? See here. See here. This has gone comfortably into the sacroiliac joint, and a needle pass through like this, and this is into the sacroiliac joint. Now since I am in the sacroiliac joint, I am giving a diagnostic 2 ml local anesthetic injection. If it is in the right space, patient will complain. Patient will say that the pain is relieved. Okay. Pause. The this is the injection triamcinolone. This completes the procedure. Almost 15 minutes after the procedure, we will repeat the Faber test. The Faber test was positive for sacroiliitis pre-injection. Now we will see whether there has been some relief or not post-injection. So I will repeat the Faber test. So pre-injection, the moment I had positioned the patient in this position and I was trying to put it down, the patient complained of severe pain. She was shouting with pain. Now post-injection, see, till this point it has become equal to the contralateral limb. Patient is absolutely comfortable. See the expression of the face. Patient is absolutely comfortable till this point. But before injection, patient shouted at this position only. Now see, it is completely comfortable. Thank you.